I'm a psychologist, and I have worked in the area of cancer, working with patients and families for the last 10 years. And I say everything that I know about coping with and living well with cancer, I've learned from patients and family members. And I'm really so honored to be able to be here and to be a part of this, this wonderful symposium. And to talk about what I think is a really important aspect of living well with pancreatic cancer, which is how to manage the impact of stress, worry, and anxiety in this process. So my goals for this brief talk are to hopefully help you define and understand some of the triggers for stress as you deal with your treatment, develop some specific tools and strategies for managing the impact of that stress, and lastly, to have a discussion that goes beyond just management of stress and anxiety, but really begins to think about what we mean by having an integrated sense of well-being, and for you all to walk away with some ideas of how to begin to incorporate that into your own lives. I want to begin by acknowledging that the journey of living with any cancer is defined by movement. It's not a fixed state or identity, but really a fluid and evolving experience unique to each of you, whether you're a patient or family member or loved one. It's processed differently at different stages of treatment and in the lifespan, depending on where you are in your life, what you're busy doing and trying to accomplish. But it's always marked by both periods of stability and mastery, a sense of you've got a handle on this, you know what to expect, you're figuring it out, and those inevitable periods of vulnerability and uncertainty as you have to renegotiate what the tasks and challenges of the experience are like. So where does stress fit into this picture? Well, I think just what we've said is one of the defining features of stress, living with uncertainty and loss of control. Stress is a normal human response. Classically, it's defined as the physical, mental, and emotional reactions that all humans, in fact all mammals, have to the perception of threat. It's helpful in short bursts. Evolutionarily, it's what helped all of our ancestors to avoid that saber-toothed tiger. It's helpful for you when you're in the midst of a car accident that's about to happen, but it's not helpful as a chronic way of life or when it accompanies a feeling of not having any control over what's happening. Modern life is endemic with stress, as it is, but it's particularly difficult when the challenge is also living with something like pancreatic cancer. How do you manage your sense of threat, danger, anxiety when that threat is neither imminent and nor does it pass like that saber-toothed tiger? How do you keep from becoming immobilized by this worry and anxiety that stress brings on? Well, you do so by developing multiple and flexible strategies for managing that stress. And that includes, one, knowing what is stressful and being able to identify and anticipate it. That's half the battle right there. The other half is being able to accept that stress and all the feelings that go with stress can't be eliminated, but they can be managed. And, well, the last half, and this isn't to tell you that I can't add, but to recognize how daunting this task is to exercise the choices that you have that can help you to manage your reactions. So in the experience of living with a cancer diagnosis or caring for somebody, loving somebody who has a cancer diagnosis, there are many, many opportunities for disruptions in that equilibrium that we talked about, that sense of mastery and stability that can be brought on by both expected and unexpected events. These include side effects and symptoms from treatment itself, the ongoing ones that can be impairing in your functioning, that limit what you're able to do and how you can act in all the roles in your life, and the new ones that bring on worries of, is this going right? Am I doing something wrong here? Scans and appointments, even when they're scheduled, are flashpoints for opportunities for change, hopefully for good, but not always, and are nearly always accompanied by stress and anxiety. There's a whole series of performance demands, questions about, am I being strong enough? Do I have the right attitude? Am I positive enough? Am I making the right changes in my life that can only add to the experience? And the last is what I call news from the outside. This is when you're going about having a perfectly cancer stress-free day yourself, and you come across an internet story, or in your car there's a news story about some cancer study or something else that comes along and knocks you off course. Over the next several slides, I'm going to talk about some specific strategies for naming and managing these stress triggers. So as Dr. Rosen so wonderfully put it, it's really important as you think about the triggers and stressors related to your treatment and care, that you have a shared language with your treating physicians. Ask for discussions about your treatments in ways that are comfortable and meaningful to you. As Aggie said earlier, statistics are useful to an extent. They're important for research, but they're not useful or relevant in you living your life well, or helping your doctor to understand what's important to you. Having that shared language about your treatments is also really critical. So when you're talking to your doctor, that you can explain the intensity of symptoms that you have, the duration of the symptoms, how long do they last, on a scale of 1 to 10, and most importantly, how are they functionally impairing for you? What do they keep you from doing in your life that's important to you, whether that's keep you from gardening or keep you from spending the kind of time you want with your kids or grandkids. Those are all really critical because they help to move the discussion about treatment, not just about the goal of more treatment, but really the goal of what you're living for, the things that bring meaning to your life. In each of these slides, I have here at the bottom some research that supports the recommendations that I'm making. So this study indicates that higher levels of distress exist among patients who engage in high health surveillance but don't access healthcare support. So it's really important. You are going to be doing a high level of surveillance. It's part of the experience of going through treatment for pancreatic cancer. Be sure to access your healthcare team and to develop that kind of language so that you get the best care. The other team that you need to communicate well with are those closest to you, your loved ones, your family and friends. It's really, really common for both patients and family friends to avoid talking about the real things of living with cancer. It comes from a desire to protect and to make the experience as normal as possible, but often just leads to isolation. It's helpful to talk through the changes, to talk about what it is you need and want. This allows you and the people around you who love you to prepare for the stressful events, those scans and doctor's appointments and procedures, but also for the good events. And truthfully, good events can be stressful too. It's a lot easier to enjoy that wedding or that family trip or that graduation that you've been wanting to get to when you and the people around you, your loved ones, are on the same page about what's doable and what's comfortable for you. As you move through the ups and downs of living with cancer, it's also useful to focus on relationships, on the many rich ways that you embody being a mother, a grandfather, a sister, a daughter, and not so much on just the role function of that relationship that can ebb and flow, and ultimately is not the most important thing to the people who love you. the research shows, not surprisingly, that individuals with access to social support express less anxiety and worry. One of the common sources of stress for people living with pancreatic cancer are all the recommendations for nutrition and lifestyle changes. These are important to do, but it's important to think about how to incorporate these changes in a way that helps your sense of well-being and doesn't add to your level of stress. Discuss the targets for the changes you want to make, and as you do so, avoid all or nothing thinking, the kind of thinking that says, there's nothing I can do to make this better. Or, I think even more difficult and damaging, if I don't do this, if I don't make this change, then all is lost. That's a great deal of pressure, and often just is not accurate. So commit to realistic, achievable goals for the kinds of changes that you want to make. And the research also supports this. Fear during cancer is reduced with higher levels of confidence in the ability to engage in healthy behaviors. Not necessarily what those behaviors are, but confidence that you can do this and make these choices and changes. I love psychosocial research because it's so good at telling us what we already know. As we mentioned at the very beginning, one of the most disequilibrating aspects of managing a cancer diagnosis is the news that comes not from within your own life or your own body, but the news from outside that can really throw you off course. As I said, whether it's that internet story or a study on the radio, or I think most difficult, learning of someone close to you who either develops a new diagnosis or passes away from a diagnosis of cancer. Just as you're careful about everything else you consume, practice choice about how you consume information. Stay grounded in your own story and allow for the distress and sadness that's inevitable when you hear this kind of information, but also really make room for moving back into your own life and not staying stuck within this information. So engage in an activity that's enjoyable to you, or not enjoyable to you, just distracting, like cleaning your closets. Reach out to a loved one, reach out to a friend. Don't get shut out of your own life. So all the things we've talked about are transient stressors and triggers that bring about transient stress. But they can also just as easily become chronic and ongoing. So symptoms of anxiety, sadness, worry that persist for several weeks, or that truly impact your functioning, that disturb your sleep, your concentration, your ability to do the things you need to be treated like any other symptom that you're experiencing. Take that to your doctor, talk to him or her, and then also get expert care. Speak to a psychologist who's knowledgeable in the area, get treatment from a psychiatrist who understands working with cancer so that you can get back on track. Okay, we'll take a deep breath here. We've been talking about stress and stressors and triggers and specific strategies. In this next part, I want to sort of move the pace a little bit, these last few slides, for us to begin thinking about mind, body, spirit, well-being as something that's beyond managing stress. I'm going to borrow an exercise from Warren Mullen, who's written a wonderful book that I recommend called Being, Living, and Doing Enough. Okay, so bear with me. In this exercise, I'm going to ask each of you to first conjure up some images, okay, and we'll see how you do. Imagine a Volkswagen Beetle, the Statue of Liberty. Imagine the answer to the question, what's 2 plus 2? A slice of apple pie. How did everybody do? Could keep up? Yeah, nods? A talented and gifted audience. Okay, so we're going to change up the exercise a little bit. I'm going to ask you to imagine how you felt the first time you drove a car. What you believe is important about being patriotic. How you feel if I say we're about to have a pop math quiz right now. If you imagine the taste of your favorite dessert from your childhood that your mom made just for you. So the point of this exercise, and I hope it was revealing, is that we're much better at dealing quickly with data and information and facts that aren't connected to anything in our lives. And that thinking about and processing and feeling those things that are important, that do matter to us, is a much more complex, a slower process that requires time. And really, what is there in living with pancreatic cancer or being a loved one of someone with pancreatic cancer that doesn't require the integration of your mind, body, and spirit, and doesn't require that kind of slow processing and time and energy? So I want to move away, as I said, from talking about tools and strategies and stresses to thinking maybe just about some principles of well-being. And these next few slides are not so much recommendations as thoughts about how to cultivate a sense of well-being for yourself. Okay, so everything on this slide, meditation, visualizations, movement of any kind, walking, qigong, yoga, they're all excellent and powerful allies in dealing with that flight or fight response, that stress response that we talked about earlier. But more importantly, they're all gentle and undemanding ways of being a friend to your body. Your body, which goes through so much, has also been the seat, the origin of wonder and pleasure your whole life. It's the first thing you knew of your senses and of the world. Wouldn't it be nice if your body could again participate in being a source of pleasure and comfort and joy for you? So how many of you have been told, just be positive, anytime within the last couple of weeks? It seems to be the mantra of anyone who's talking to someone with cancer. And I have nothing against being positive. In fact, I think positivity is really important and absolutely critical at the beginning of this whole process. When you're confronted with the diagnosis for yourself or someone you love and your world is turned upside down, you need to be positive to know that you'll be able to figure out what to do, that you'll be able to make sense of all of that new information, make the right choices, that you'll have the will to fight and continue on. And you all have done that. But as you move through the process, you gain something beyond positivity. You gain perspective, and that's a deepening of your knowledge about what you need and what you can do in this experience. You're able to tolerate and anticipate discussions and plans and cherish aspects of living with cancer that you never thought possible. And none of this is the opposite of positivity. It's just the maturing of it, and is essential for being able to live fully each day of your life. The first bullet point says, allow for all feelings, make choices about attitudes. I often say that feelings are like the weather, like rain. They come and they go. They're not good or bad. They're not right or wrong, and they can't really be controlled. Attitudes are being smart enough to carry a sturdy umbrella and have galoshes with you if you live in a part of the country that's particularly rain-soaked. Those are the choices and the beliefs and the behaviors that help you get to where you're going. But sometimes there's a storm of feelings, and the only thing to do is wait it out Seek refuge, take shelter, and wait for the storm to pass. And that's the right thing to do too. Lastly, I want to encourage you in engaging your spirit to practice self-compassion. This may be the most healing thing that you can do for yourself, whether you're a patient or a loved one. And no one can do it for you. So let go of those ideas or thoughts that you're not doing enough or you're not doing it right, and really allow yourself to have a sense of peace and well-being. Share the experience, don't be isolated in it, and locate your own important sources of strength, comfort, meaning, and joy. If living with uncertainty, worry, doubt, fear are things that you have to navigate, that you don't get a choice about in this experience, then I would encourage you to anchor your days also with the things that bring meaning and comfort, and make sure that those are constants in your day-to-day. So stress in the context of the cancer experience can't be eliminated. It's connected to a knowledge of vulnerability. It's both a burden to be managed, but also surely a reminder of what's precious and why you're doing all of this. So what are you doing right in this whole process? Hopefully being proactive with your emotional as well as physical well-being, following healthcare recommendations, taking the time to learn healthy coping that works for you, and then really making those choices about practicing those tools that you've taken on and those principles so that you have the richest life that you can. Where can you go for additional support? The Simsman Center offers groups and counseling and access to all kinds of wonderful lectures. There's a link to a wonderful meditation site, and of course, the Hirschberg Foundation itself. Thank you so much.